Hi there. Welcome to our channel where we share real practical tips to help you live healthier and stronger every day. Did you know that most cancers in older adults start with quiet, sneaky symptoms that seem totally harmless at first? A little heartburn, a bit of tiredness, maybe some night sweats. It's easy to brush them off as just part of getting older, but sometimes those are the early warning signs of cancer. In today's video, we're going to uncover 8 surprising signs you should never ignore if you're over 60. These are signs that don't seem serious until it's too late. And here's why you'll want to watch all the way to the end. We'll also reveal 3 everyday foods that can actually help lower your cancer risk backed by real science. So stick around, and if you find this helpful, hit that subscribe button and turn on the bell so you don't miss out on more health tips every week. Sign number 1, a vague feeling that something is off. Sometimes the earliest warning sign of cancer isn't dramatic or painful. In fact, it can be so subtle that many people ignore it entirely. It might feel like a general sense that your body isn't quite right. Not sick, not in pain, just off. This vague, hard-to-explain feeling is more common than most people think, especially in older adults over 60. And while it's easy to dismiss as stress fatigue or just aging, this sensation can actually be one of the body's first attempts to raise a red flag. So what does this off feeling really look like? For many, it starts with unusual fatigue. Not the tiredness that comes after a busy day, but a kind of deep, persistent exhaustion that doesn't improve with rest. Everyday tasks like walking the dog, grocery shopping, or even getting out of bed may suddenly feel like a big effort. You might feel mentally foggy or more forgetful than usual. Some describe it as feeling emotionally flat or unusually anxious for no clear reason. Others say it's like they've lost their usual energy or spark a sense of disconnection from themselves. Why does this happen? In some cancers, especially blood-related ones, like leukemia or lymphoma, cancer cells release substances called cytokines, chemicals that trigger inflammation and interfere with how your brain and body normally function. These substances can mess with your sleep cycle, appetite, memory, and even mood, all without causing any noticeable pain. And because this feeling builds gradually, it's easy to think, maybe I'm just getting old, or maybe I just need more rest. But when this sense of unease lingers for weeks, or gets slowly worse, it could be your body's way of whispering that something deeper is wrong. It's also worth noting that this general feeling of unwellness often appears before other classic symptoms of cancer, like weight loss, lumps, or changes in bodily functions. That's why it's so important not to wait for more obvious signs before taking action. Trusting your instincts can truly make a life-saving difference. If this sounds familiar, if you've been feeling not quite like yourself for more than 2 weeks and you can't explain why, it's time to listen to your body. Don't try to tough it out or wait and see. Schedule a visit with your doctor and describe exactly what you're experiencing, even if it feels vague. Be honest. Say things like, "I just don't feel like myself lately," or "I feel tired in a way that's different from normal." A good doctor will take that seriously and may order blood tests, scans, or check your overall health more closely. Remember, you are the best expert on your own body. No one else can feel what you're feeling. And when something doesn't feel right, even if you can't put your finger on it, it's always better to check. Catching cancer early, even in this uncertain phase, often leads to more treatment options and far better outcomes. So if you or someone you love has been quietly feeling off, don't ignore it. Pay attention. Get it checked. It might just be your intuition, or it might be the early warning you need to take control of your health. Sign number 2, unexplained night sweats. Waking up drenched in sweat even when the room is cool and you're only using light bedding isn't just uncomfortable, it could be a serious warning sign. While night sweats are often brushed off as a normal part of aging or attributed to menopause anxiety or warm weather, persistent and unexplained night sweats, especially in adults over 60, can be one of the earliest and most overlooked signs of cancer, particularly blood cancers like lymphoma or leukemia. What sets cancer-related night sweats apart from ordinary ones is their intensity and persistence. These aren't the occasional light sweats that come after a vivid dream or a warm blanket. We're talking about soaking through your pajamas or needing to change your sheets sometimes more than once in the same night. They tend to happen repeatedly, night after night, and often come without any obvious reason. There's usually no fever, no infection, no change in your sleep environment. Just a sudden, unexplained flood of sweat that leaves you feeling weak, clammy, and sometimes even chilled once the sweat evaporates. This phenomenon happens because certain types of cancer, especially lymphoma, cause your immune system to go into overdrive. The cancer cells release substances known as cytokines, which act like internal messengers and can confuse the body's temperature regulation system. Your body reacts by trying to cool down, even when it's not hot, resulting in intense drenching sweats, often during deep stages of sleep. Another thing to watch for is how these sweats affect your energy and mood. Many people report feeling unusually tired or irritable the next day, and some may also experience mild weight loss, low-grade fevers, or a general sense of weakness. While each of these symptoms on their own might not raise concern, when combined with regular night sweats, they should prompt a visit to your doctor. What makes night sweats so dangerous is how easy they are to ignore or misinterpret. A lot of people assume they're a normal part of aging or blame them on a new medication, stress, or diet. But the key difference lies in duration and frequency. If you've been waking up drenched in sweat for more than a week or two, and there's no clear explanation such as illness, menopause, or medication, then it's time to take it seriously. These sweats aren't just annoying. They could be your body's way of warning you that something more serious is going on inside. Doctors often start with basic blood tests to rule out infections, thyroid issues, or hormonal imbalances. If those come back normal and the sweats persist, they may recommend further testing, such as imaging scans, lymph node evaluations, or even bone marrow biopsies, especially if other signs like swollen glands, fatigue, or unexplained weight changes are present. It's important not to self-diagnose or ignore this symptom, because catching cancer early makes a huge difference in treatment outcomes. In fact, early-stage lymphoma often responds very well to treatment, but only if it's identified before it spreads. That's why recognizing night sweats as more than just a nuisance could truly save your life. So if you've been consistently waking up sweaty for no clear reason, don't wait it out. Talk to your doctor. It might turn out to be something minor, but if it's not, early action can make all the difference. Sign number 3, changes in your nails or fingertips. Most of us don't pay much attention to our nails unless we're trimming them or noticing a break. But did you know that your nails can quietly reflect serious internal health problems, including cancer? While nail changes are often dismissed as cosmetic or age-related, certain unusual changes in your nails or fingertips may be an early warning sign of cancer, especially lung, skin, or gastrointestinal cancers. This is a subtle signal, but a very important one that is easy to miss if you're not looking for it. One of the clearest signs to watch for is a condition known as nail clubbing. This happens when the tips of your fingers become rounder, fuller, and the nails begin to curve downward over the fingertips. The area under the nail may feel soft or spongy to the touch. Clubbing is often associated with low oxygen levels in the blood, which can be caused by chronic lung conditions, but it's also a common sign of lung cancer, especially in its early stages when other symptoms like coughing or chest pain haven't yet appeared. That's why noticing nail clubbing early could give you a critical head start in detecting and treating cancer before it spreads. Another serious nail change to look out for is the appearance of dark vertical stripes or streaks under the nail. These may look like small bruises or black lines, often mistaken for minor injuries. However, If you haven't hurt your finger and the streak doesn't grow out with the nail or begins to spread, it could be a sign of sublingual melanoma, a rare but aggressive form of skin cancer that starts under the nail. This is more common on the thumb or big toe and is often overlooked until it has advanced. In people with darker skin tones, these streaks may be harder to spot, making early awareness even more crucial. You should also be mindful of other unexpected nail changes like brittleness, grooves, pits, or a sudden change in color or texture. While these can sometimes be linked to nutrient deficiencies or conditions like psoriasis, if they appear suddenly or affect just one nail, they could indicate an underlying cancer affecting the skin immune system or internal organs. In some gastrointestinal cancers, nail changes may occur because of poor absorption of nutrients or systemic effects of the disease. It's also not uncommon for blood cancers like leukemia to affect the nail beds, leading to unusual bleeding, discoloration, or delayed nail growth. What makes these signs so easy to overlook is how gradual they are. You may not notice clubbing or discoloration until comparing your fingers side by side, or until a loved one points it out. But early detection is everything when it comes to cancer, and in many cases these nail changes appear well before more obvious symptoms set in. If you notice any new unexplained or persistent changes in your nails or fingertips, don't ignore them, especially if they appear alongside other symptoms like fatigue, weight loss, or changes in breathing. It's important to bring them up with your doctor. A simple physical exam may be followed by blood tests, imaging scans, or referrals to specialists to investigate further. In many cases, early evaluation can lead to timely diagnosis and much better outcomes. So the next time you trim your nails, take a moment to really look at them. Are they changing in shape, color, or texture? Are your fingertips swollen or unusually curved? These small details could be telling a much bigger story, one that could potentially save your life if caught early enough. Sign number 4, bone pain that has no clear cause. As we age, aches and pains often become part of everyday life. A sore back, stiff joints, or mild discomfort after physical activity is usually nothing serious. But when bone or joint pain comes out of nowhere, persists for weeks, and doesn't seem to follow a clear cause like an injury or overuse, it may be time to take a closer look. Unexplained lingering bone pain, especially in adults over 60, can sometimes be a silent sign of cancer. It's a symptom that's often written off as arthritis or just getting older, but in some cases it points to something more serious beneath the surface. Bone pain related to cancer is different from the typical soreness you might feel after gardening or sleeping in a strange position. Cancer-related pain tends to be deep, dull, and persistent, and it doesn't improve with rest or common over-the-counter medications. In fact, it often gets worse at night, sometimes disturbing sleep or intensifying without any physical movement. This type of pain may also be localized. You might feel it in one spot, like the lower back, hip, or ribs, and it gradually worsens over time instead of improving. One major concern when this symptom appears is bone metastasis, which occurs when cancer from another part of the body, such as the breast, prostate, or lung, spreads to the bones. The spine, pelvis, and thighs are the most common areas affected. In other cases, the pain may be a result of primary bone cancer, a rarer form that originates in the bone itself. Cancers like multiple myeloma, leukemia, or lymphoma can also lead to widespread bone discomfort due to their impact on bone marrow and surrounding tissues. Another clue is how resistant this pain is to usual treatments. If stretching, hot packs, rest, or anti-inflammatory medications don't help, or the relief is very temporary, that's a red flag. Some people describe this pain as gnawing or pressure-like, as if something is pressing or expanding inside the bone. It may also be accompanied by swelling, tenderness to touch, or reduced mobility in the affected area. In advanced cases, bones may weaken and become prone to fractures from even minor bumps or falls. It's important to understand that cancer-related bone pain rarely shows up alone. It may come alongside other subtle signs like unexplained fatigue, low-grade fever, or weight loss. However, in some people, bone pain is the very first and only noticeable symptom. That's why it's critical to trust your body and seek medical attention if something feels off. If you've been dealing with the same ache for weeks and there's no clear reason behind it, your doctor may recommend imaging tests like X-rays, MRIs, CT scans, or bone scans to get a better picture. Blood tests may also be needed to look for markers of inflammation or abnormal cell activity. Early detection is key when it comes to bone-related cancers or metastasis. The sooner a diagnosis is made, the more treatment options are available, and the better the chances of managing or even reversing the condition. Waiting too long can allow the cancer to spread or cause irreversible damage to the bones and surrounding tissues. Sign number 5: skin that suddenly looks or feels different. We often think of skin changes as cosmetic or simply part of aging. A little dryness here, some wrinkles there, maybe an odd itch or bruise. But certain sudden and unexplained skin changes, especially in older adults, can be early signs of cancer. Your skin is your body's largest organ, and when something's wrong inside, it often tries to tell you through changes on the outside. While some symptoms might appear harmless, it's important not to overlook them, especially when they persist or appear without a clear cause. One of the most overlooked warning signs is persistent itching in one specific area that doesn't go away with creams, allergy medications, or improved hygiene. This kind of itching may seem minor at first, but if it lingers for weeks or becomes more intense, it could be an indicator of underlying blood cancers like lymphoma or leukemia. Unlike normal dry skin, this itch often isn't accompanied by a visible rash, or it might show only a faint discoloration or mild dryness. But the sensation can be constant and frustrating, especially at night. Another common red flag is unusual skin discoloration or thickening, particularly in areas not typically exposed to the sun. One rare but important example is a condition called xanthosis nigricans, where patches of skin, especially around the neck, underarms, or groin, become dark, velvety, and thickened. While this can be related to insulin resistance or diabetes, it has also been linked to stomach and liver cancers. If you notice this type of change, and it's new, or spreading, it's something your doctor should evaluate. Also take note if you see yellowing of the skin or eyes, known as jaundice. This is not just a liver problem. It can be a warning sign of pancreatic or gallbladder cancer. Even a slight yellow hue that lingers should be taken seriously, particularly if it's paired with fatigue, dark urine, or pale stools. Skin changes can also include unexplained bruising, especially in places where you haven't had an injury. If you start noticing bruises on your arms, legs, or abdomen that appear easily and take longer than usual to heal, this could be a sign of blood-related cancers like leukemia. These cancers interfere with normal blood clotting, leading to spontaneous bruising that doesn't fit your usual patterns. Another subtle but significant symptom is the appearance of sore scabs or lesions that don't heal within a few weeks. While it's common for wounds to take longer to heal as we age, persistent open sores, especially on the face, scalp, lips, or ears, can be early signs of skin cancer, including basal cell carcinoma or squamous cell carcinoma. These types of cancer are usually slow-growing, but can become serious if left untreated. What sets these skin changes apart from normal aging is how suddenly they appear and how long they persist. Cancer-related skin changes tend to stay spread or worsen over time. They might not respond to moisturizers or basic treatments, and often there's no logical explanation, like allergies or injury. In some cases, these changes are the first sign that something's happening inside the body long before other symptoms appear. If you notice any skin change that's new, unusual, or doesn't improve after 2 to 3 weeks, whether it's a strange patch, discoloration, persistent itch, or sore, don't ignore it. See your doctor or a dermatologist. They may perform a skin biopsy or order blood tests to rule out more serious causes. Catching cancer in its earliest stages through something as visible as your skin could save your life. Sign 6. Strange or new stool changes. Talking about bowel movements might feel uncomfortable, but your stool can reveal a lot about what's happening inside your body. While occasional changes are normal, such as after eating certain foods or taking medication, persistent unusual changes in your stool could be an early sign of cancer, especially in the colon, rectum, pancreas, or liver. If you're over 60 and notice differences that don't go away after a couple of weeks, it's time to pay closer attention. One of the first changes to watch for is a significant shift in bowel habits. That includes frequent constipation, diarrhea, or alternating between the two without a clear reason. While diet stress or dehydration can cause temporary irregularities, ongoing disruptions, especially when paired with other symptoms, may signal a deeper problem. Colon cancer in particular often begins with subtle changes in how and when you go to the bathroom. Another concerning sign is a change in the shape of your stool. If your stool becomes consistently narrow, almost ribbon-like, it could be caused by a growth or obstruction in the colon that restricts the passageway. This isn't something to ignore, especially if it appears regularly and isn't linked to any recent dietary change. Tumors pressing on the colon wall can slowly alter the way waste exits your body, and these shape changes are often one of the earliest. Color also matters. Pale clay-colored stools may indicate a blockage in the bile ducts, potentially due to liver or pancreatic cancer. On the other hand, dark or tar-like stools could be a sign of bleeding in the upper gastrointestinal tract, such as the stomach or small intestine, which can be caused by cancers in those areas. These colors are usually not caused by food, and they often signal that blood is being digested before exiting the body. Blood in the stool, whether bright red or darker and hidden, is a particularly important warning sign. It can be easy to assume this is due to hemorrhoids, especially for older adults, but bleeding from within the digestive tract should always be taken seriously, especially when it's frequent or occurs without straining. Even small traces of blood can indicate polyps or cancerous growths in the colon or rectum. You should also pay attention to how your bowel movements feel. Do you often feel like you haven't fully emptied your bowels even after going? Is there increased urgency but little output? Are you experiencing more bloating, gas, or abdominal cramping than usual? These symptoms suggest that something may be interfering with the normal movement and emptying of the intestines. A common issue when a tumor is present. It's important to know that many people delay seeing a doctor about bowel symptoms out of embarrassment or hope that they'll just go away. But waiting can allow something treatable in its early stages to become more dangerous and harder to manage. Colorectal cancer, for example, is one of the most preventable and treatable cancers, but only if caught early through signs like these or routine screening tests like colonoscopies. If you've noticed any stool changes that last more than 2 weeks, don't guess, get checked. Your doctor may recommend a stool test, imaging, or a colonoscopy to determine the cause. The goal isn't to jump to conclusions, but to rule out serious conditions before they advance. By paying attention to your body's natural signals, even the ones we tend to ignore, you give yourself the best chance to catch something serious before it becomes life-threatening. Sign number 7, eye pain or changes in vision. When we think of cancer symptoms, eye problems rarely come to mind, but that's exactly what makes this warning sign so dangerous. Eye pain or sudden changes in vision are often dismissed as part of aging or eye strain, especially in people over 60. However, persistent or unexplained issues with your eyes may in some cases signal cancers that either start in the eye or have spread there from other parts of the body, such as the lungs or breasts. This sign is subtle, easily misunderstood, and often overlooked, but recognizing it early could make a real difference. First, Let's talk about ocular melanoma, the most common form of eye cancer in adults. It develops in the cells that produce pigment inside the eye, often without causing any visible tumor or redness. One of the first signs people notice is blurry vision in one eye that doesn't improve with glasses or eye drops. Others may describe it as seeing shadows, flashes of light, or even floaters that linger, not the usual specks you sometimes see, but darker shapes that interfere with sight and don't go away. Pain is not always present, but when it is, it can feel like a dull ache behind the eye or a sensation of pressure similar to sinus tension. This type of discomfort is easy to overlook because it may not be severe. However, if it's consistent or paired with vision changes, it should not be ignored. In some cases, cancer-related eye issues affect the retina or optic nerve, leading to distorted or double vision difficulty, seeing at night, or even a sudden loss of peripheral vision, as if parts of your visual field are missing. Another important but less known situation occurs when cancer from another area of the body spreads to the eye. For instance, breast cancer and lung cancer are among the most common cancers to metastasize to the eye. These secondary tumors can cause swelling vision loss or a sensation that the eye is being pushed forward. Sometimes the only sign is a persistent difference in how each eye sees or feels. One eye might be blurrier, more sensitive to light, or even appear slightly different in size or position. It's also worth noting that many eye exams don't catch deeper issues unless a specific test is done. General vision tests or even routine checkups may miss changes happening at the back of the eye. That's why specialists often use ocular ultrasounds, retinal scans, or contrast-enhanced imaging to get a full view of the eye's internal structures when something seems off. One of the challenges with cancer-related vision changes is that they can easily be confused with cataracts, glaucoma, dry eyes, or other age-related eye conditions. But there's a key difference: these symptoms tend to progress quickly or persist despite treatment. If you've been using prescription eye drops or adjusting your glasses and still notice no improvement, or if the symptoms are affecting only one eye, that's a red flag. You should never assume that all vision changes are just part of getting older. If you or someone you love notices sudden eye pain, blurring, flashing lights, or vision loss, especially if it's isolated to one eye and doesn't go away, see an eye specialist right away. Early detection of ocular or metastatic eye cancers can allow for less invasive treatment and preserve your vision left unchecked. However, these cancers can lead to permanent damage or even signal that another cancer in the body has spread silently. Sign number 8, persistent heartburn. Heartburn is one of those symptoms most people experience now and then, after a spicy meal, eating too fast, or lying down right after dinner. But if you're over 60 and experiencing persistent or frequent heartburn, it's time to take it more seriously. While occasional acid reflux is common and usually harmless, ongoing or worsening heartburn can be a sign of something far more serious. Cancer, particularly in the esophagus or stomach. So how do you tell the difference between harmless indigestion and a real red flag? Cancer-related heartburn doesn't just flare up after eating heavy meals. It sticks around sometimes even when your stomach is empty. You might feel a burning sensation in the chest or throat, a sour taste in your mouth, or a feeling that food is coming back up. It might wake you up at night, interfere with eating, or force you to rely on antacids almost daily just to feel normal. When these symptoms become part of your routine, it could be your body's way of warning you about underlying damage in your digestive tract. Chronic acid reflux, especially when untreated, can lead to a condition called Barrett's esophagus, where the lining of the esophagus changes at the cellular level due to long-term exposure to stomach acidity. This change increases the risk of developing esophageal adenocarcinoma, a serious and often aggressive form of cancer. The scary part is that this transformation happens slowly and silently over time. You may not feel anything dramatically different, just more of the same discomfort that you've been ignoring or treating casually. Another overlooked symptom that often accompanies persistent heartburn is difficulty swallowing. If you start noticing that food feels like it's getting stuck on the way down, or if swallowing becomes uncomfortable or requires effort, this may indicate a narrowing of the esophagus caused by inflammation or even a tumor. Over time, you might also develop a hoarse voice in the morning, constant throat clearing, or even an unexplained cough, signs that acid is irritating more than just your stomach. What makes persistent heartburn especially dangerous in older adults is how often it gets normalized. Many people chalk it up to aging or dietary choices, especially when over-the-counter medications seem to help at least temporarily. But when heartburn lasts longer than a month and keeps returning even after you adjust your eating habits, it's time to go beyond self-treatment. Doctors can perform an endoscopy, a simple procedure using a thin, flexible camera to examine the esophagus and stomach lining for signs of irritation, abnormal growths, or early cancerous changes. If caught early, many of these issues can be managed with lifestyle changes, medications, or minimally invasive procedures. But left untreated, esophageal or gastric cancers often progress silently until they're in more advanced, harder-to-treat stages. Also, it's not just the frequency of heartburn that matters, it's also how it affects your daily life. If you're avoiding certain foods, sleeping, sitting up, or skipping meals just to keep symptoms in check, your digestive system is clearly trying to tell you something. Don't ignore that message. The longer the acid eats away at your tissues, the greater the risk of irreversible damage or cancer development. So, if heartburn is becoming your constant companion, don't reach for another antacid and move on. Instead, reach out to your doctor and ask for a deeper evaluation. Early detection can save your esophagus, your stomach, and potentially your life. 3 foods that help reduce cancer risk. While no single food can completely prevent cancer, research consistently shows that certain ingredients in our everyday meals can help lower the risk by supporting the body's natural defenses. These foods aren't exotic or expensive, they're simple, accessible, and backed by science. Adding them to your weekly diet can make a real difference in reducing inflammation, improving cell health, and enhancing your immune system's ability to detect and destroy abnormal cells before they become dangerous. Let's start with one of the most powerful vegetables, broccoli. This green veggie, along with its relatives like cauliflower, cabbage, and Brussels sprouts, belongs to a group called cruciferous vegetables. What makes broccoli special is a natural compound called sulforaphane. When you chew or chop broccoli, this compound activates and goes to work on a cellular level. Studies have shown that sulforaphane can help neutralize carcinogens, reduce inflammation, and even block enzymes that promote cancer cell growth. One long-term study involving over 50,000 men found that those who regularly ate cruciferous vegetables had a significantly lower risk of developing aggressive prostate cancer. Even more impressive, lightly steaming broccoli for just 3 to 4 minutes helps preserve its cancer-fighting properties better than boiling. Whether added to soups, stir-fries, or enjoyed roasted, broccoli is one of the simplest and most effective choices you can make to support long-term health. Next up, tomatoes, a common kitchen staple with extraordinary benefits. Tomatoes are packed with lycopene, a powerful antioxidant that gives them their vibrant red color. Lycopene has been linked to reduced risk of several types of cancer, especially prostate, lung, and stomach cancers. Unlike some nutrients that are lost during cooking, lycopene actually becomes more bioavailable, easier for your body to absorb when tomatoes are cooked. That means tomato sauce soups and stews are not only comforting, but protective too. One study published by the Journal of the National Cancer Institute found that men who consumed tomato products more than 10 times a week had a 35% lower risk of developing prostate cancer. And it's not just men who benefit. Lycopene also supports the immune system and helps fight free radical damage in both sexes. Just remember to choose products without added sugar or excess salt, and whenever possible, make sauces and salsas at home from fresh or canned whole tomatoes. Last but definitely not least, berries, especially blueberries and raspberries. These small but mighty fruits are loaded with vitamins, fiber, and a group of compounds called anthocyanins. These plant pigments not only give berries their deep colors, but also act as antioxidants, helping to protect cells from oxidative stress, a key factor in cancer development. Berries also contain ellagic acid, which has been studied for its ability to slow the growth of cancer cells and help the body eliminate carcinogens more effectively. In one lab study, rats that were fed a diet rich in berries had a 58% reduction in esophageal tumors compared to a control group. In humans, regular berry consumption has been linked to lower levels of inflammation and improved gut health, both critical to maintaining a strong immune system and regulating abnormal cell growth. Berries are also a fantastic source of natural fiber, which supports digestion and may help reduce the risk of colon cancer. Best of all, they're delicious and versatile. Toss them into smoothies, sprinkle them over oatmeal, or enjoy them as a refreshing snack on their own. Including broccoli, tomatoes, and berries in your regular diet is a simple but powerful way to take control of your long-term health. These foods don't just nourish, they protect. By supporting your body at the cellular level, they help reduce the risk of various cancers while also enhancing overall energy, digestion, and resilience. Cancer doesn't always scream, sometimes it whispers through subtle signs like fatigue, heartburn, vision changes, or even your stool. The key is knowing when to listen and not brushing off what feels off. And by adding powerful foods like broccoli, tomatoes, and berries to your meals, you're giving your body an extra line of defense. If you're over 60 or caring for someone who is, stay alert to these early signals. Early action can save lives. If you found this helpful, give the video a like, share it with your loved ones, and subscribe to our channel for more expert-backed health insights every week. Your health is your power. Let's protect it together.